Hi, my name is Amit Yajnik, and I'm the Director of Cardiothoracic Anesthesia here at Atrium Health. We're excited to have you here for your anesthesia rotation, and I'm really excited to see you in the cardiac and thoracic ORs. You're going to get to learn about coronary artery disease, valvular disorders, and also thoracic surgery, so you can learn about one-lung ventilation, and overall, how we as anesthesiologists help our surgical colleagues deliver complex surgical care to some of the sickest patients in the hospital. We're excited to see you, and I can't wait to see you in the OR.
Welcome, students. I'm Dr. Patel. I'm one of the anesthesia attendings here at CMC at Atrium Health, and we're very excited to welcome you guys all to our anesthesia rotation. I'm hoping to be very involved with your sim session here, so hopefully you'll have a very good experience, learn some basics about airway stuff, but also with just the basics of anesthesia and what we do and how we're involved throughout the entire hospital community. And we can't wait to see you guys and work with you, and hope you have a great time while you're here.
Hi, I'm Dr. Martinez, anesthesiologist with Scope Anesthesia, and we welcome you to your rotation in anesthesiology and hope you have a wonderful time as you embark in your first steps in learning the specialty of anesthesiology and the great impact it has in patient care.
Hi there, I'm Dr. Kumar from Pediatric Anesthesia. We are very happy and excited to have you rotate through us. Looking forward to see you. Good luck.
Welcome to Anesthesia. We hope you have a terrific experience and we look forward to having you.
Hello, I'm Dr. Lewis. I'm one of the anesthesiologists here at One Day Surgery. I'm also part of your Clerkship leadership team, so if you have any issues while you're here with us, please reach out and we can help you with them. I'm also regionally trained for my fellowship, so I might be working with you on your pain management day as well. We're so excited to teach you about blocks and anesthesia in general, and we can't wait to have you here.
Hey everyone, welcome. My name is Jenny Dinger. I'm an anesthesiologist. I'm also the medical director at One Day Surgery. We're looking forward to having you here early on your rotation. We'll go through the basics of anesthesia and in particular ambulatory care as it applies here. We look forward to working with you all.
Hope you guys enjoyed meeting some of our team. We really look forward to having you on rotation. My name is Dr. Kimberly Blasius, the Director of Academics. Next up, we have an orientation overview for you. And then when you come in person on your first day, we'll have a Q&A to follow up any questions you have about the following presentation. Look forward to seeing you soon.
All right, welcome everybody to the anesthesia clerkship rotation. We're here today to give you some information prior to coming and joining us at Atrium Health Charlotte for your anesthesia clerkship.
This is an exciting time, and we hope this slideshow and presentation help you feel more prepared for what will be a wonderful anesthesia rotation. Welcome to the team.
And in addition to the session that we're doing for you now, you will have a live question and answer session on the first day of your rotation with one of the attendings from our leadership team, as well as Jacqueline Campbell. So this slide and the next are provided as a reference for key educational leaders. Dr. Yasnik and Dr. Lewis are going to be your key clerkship contacts. You'll also receive communication from Dr. Joshua Marr, who's our IT director, and will give you access to our Scope Anesthesia website, providing you anesthesia references, as well as a daily email with your clinical assignments. And of course, our fearless clerkship coordinator, Jackie Campbell.
Hi everyone, I'm Jackie Campbell, and I'm the clerkship coordinator for the anesthesia clerkship. I'm here to help you with any questions or concerns. Please do not hesitate to reach out to me via email or on my mobile phone listed here on this slide.
Additionally, my email is listed here, Dr. Kimberly Blasius. If you have any additional concerns or questions, always available as a resource. If you are having difficulty finding your attending in the morning on the day of, you can access our Halo group, which is listed here, and they can help you find where you need to go. And an attending anesthesiologist will be the board runner each day and will be able to connect with you. So prior to the rotation, you'll have access to Canvas and the anesthesia resources within the Canvas page. We recommend, at a minimum, you review the airway and induction agents portions of this, as this will be covered very early in your rotation, especially within your first simulation. And again, expect that email from Dr. Marr to access your Scope Anesthesia website, as well as other important information from Jackie Campbell. Regardless of whether you are considering a career in anesthesia or a surgical subspecialty, anesthesia is a field you interface with from almost any subspecialty. Anesthesiologists are present throughout the hospital, from going to do difficult intubations in the emergency room, responding to codes on the floor, to working at outpatient centers and plastic surgery's offices, to of course being heavily involved in the operating room as well. Some of the benefits for you will be to better understand and appreciate the full perioperative process from preoperative optimization to recovery. You'll learn about all the phases of anesthesia care, including preoperative, intra-op, and postoperative care. Additionally, you'll have the opportunity to learn and practice key cardiopulmonary resuscitation skills that are going to be valuable for your career. Another key area of focus on this rotation is in the area of pain management, including regional anesthesia techniques, which continue to grow in popularity and be of significant value to our patients, as well as acute and chronic pain techniques and multimodal analgesic approaches. On this rotation, we welcome you to be fully part of our anesthesia care team and work with the array of providers that we have, from anesthesiologists that you'll be working with every day, to nurse anesthetists, anesthesia technicians, and all the members of the operating room team. Much of your experience on this rotation will be focused in the OR, but please keep in mind that there's a significant number and a growing number of procedures requiring anesthesia that are performed outside the operating room. These are called NORA, so non-operating room anesthesia. Lastly, our hospital typically provides anesthesia care via an anesthesia care team, that being with anesthesiologists supervising multiple sites at the same time. There's multiple different practice patterns across the country, and so we encourage you to have discussions with your attendings. Especially here, we're lucky to have a diverse group of attendings that literally come from across the country to many different practice settings. Some of ours came from private practices where they did solo cases, meaning that the anesthesiologist did the cases by themselves, to places that were more academic, to hybrid practices, to private practices, and private practices in major centers versus rural centers as well. All of these are wonderful opportunities for you to explore. A wonderful highlight to your rotation is the opportunity for hands-on, real and simulated learning. We encourage you to get your hands right in there and learn how to manage the airway. One of the focuses, of course, is going to be mask ventilation, as this could be life-saving for a patient that you will likely care for in the course of your medical school training, residency, or as an attending. So please take every opportunity to mask patients of all different shapes and sizes. Additionally, you will have the opportunity to learn other airway techniques and practice these both in the simulated environment as well as in the operating room. You may also have the opportunity to learn and practice IV access. Keep in mind this is a 2-week rotation, and focusing on airway management is already a significant lift during the rotation, but we would encourage you, especially on a patient who needs a second IV, because they'll already be under anesthesia, to consider and asking doing an IV in this situation. We of course welcome you too to come back if there's more hands-on experiences and learning you'd like to do as part of our 4th year AI. You'll be seeing lots of preoperative anesthesia evaluations, and we ask that you ask your attending permission after you've seen a good number of preoperative evaluations to go ahead and see a patient and do an anesthesia evaluation as well as an airway evaluation on a patient by the end of the rotation. And at a minimum, we'd like you to do this 2 times. Please, whenever possible, meet your patients and complete the airway evaluation with your anesthesia attending in the preoperative areas. We always want to make sure that you're learning about the patient's medical conditions, and especially anything that may potentially make them a difficult mask ventilation and/or intubation. Your learning is going to be divided in 3 ways throughout this rotation. You'll have your clinical experiences, then your didactic and simulation experiences, and third, through self-guided learning. Within your clinical learning, you'll go through a whole array of different anesthesia subspecialties, from general to the OB floor, to regional and pain, and so on. All will feel a little bit different, and this isn't a complete extensive list, again, because it's a 2-week rotation, but we invite you to ask your attendings about other subspecialties that exist within anesthesia. Your simulation experiences are broken down into 2 main simulations. Your first simulation goes over airway management and the induction process. Your second simulation will focus on pain management, and you'll get the opportunity to practice an epidural, which is a fun and challenging and tremendously valuable procedure for our patients. You'll have additionally access to a variety of recorded, traditional didactic type of lectures on your Canvas website. For the simulation, just a note that this is completely a stress-free learning environment where you have the opportunity to pause, fast forward, and rewind and ask any questions that will be tailored to your learning. Lastly, I'll get into this in a minute, is the self-guided learning topic sheet that will help guide you both for learning and filling in additional knowledge, as well as pinpoint topics that will be covered on your exam. And lastly, in the middle here is the anesthesia textbook that we recommend that you'll be receiving a copy of during your rotation, and we ask that you return that to Jacqueline Campbell at the end of your rotation. So this is the topic discussion guide that we discussed that will be part of a supplement to your learning. Each day, we would ask that you review this daily with your attending anesthesiologist so that they can see what topics you've had and what discussions you've had so far to expedite your learning and tailor it to you each day. If each day at the end of the day, you would please write down the anesthesiologist and or CRNA that taught you these topics. It's very helpful for us to track to optimize attending pairings for future learners. On this sheet, we also ask that you write down and show with a tally mark how many different procedures you have done. Again, this helps guide them to be able to teach you best for each clinical day. In addition to doing the procedural log, you will also want to be recording these in your electronic logs. And very important to note that all of your simulation experiences also count for your numbers, and so please do include those. The next two slides are going to provide a day-to-day overview of the logistical details. Please read through these in detail. You will also receive email information from Jackie and also have the opportunity to bring any questions you have about the day-to-day expectations to a Q&A you'll have with the clerkship leadership on the first day of your rotation. An extra reminder in blue here is to remember to turn in and keep track of your day-to-day topic list. So high-level reminders for day-to-day. Each day you're going to find your OR attending that you're assigned to the day prior via contacting them via the Scope Anesthesia website, where you'll have access to their phone numbers and find out where to meet and connect in the morning. Show them in the morning your daily topic list and procedural log. And then lastly, a reminder that your simulated skills do count towards your procedural skills, and please document these accordingly. An additional resource that we provide is having the opportunity to have a clinical coach that you'll have an attending you'll meet with mid and at the end of your rotation as well, towards the end of your first week and then towards the end of your second week. Somebody to sit, discuss any questions you have regarding anesthesia, your interest, your future interest, whatever it might be, a great person to reach out and connect with. You'll receive, again, their phone number as well, and on the morning that you're scheduled to meet, please text early in the morning so you can find out the best time to meet. So safety, of course, in the operating room is of utmost importance. We would love you to have the opportunity to draw up and administer medications. However, do so very carefully. Anesthesia is unique in that we do not put in orders and then get medicines from the pharmacist. We go ahead and draw the drugs up and we give the drugs right away. And so it's a little bit different of a procedure, but it's a wonderful opportunity for you to practice, especially drawing up propofol is a unique experience. Also, COVID safety, we'll be sending additional details in email. For now, please avoid any COVID positive patients. We do ask, because of COVID, that you wear an N95 mask for your protection. These are at the main desks of any of the OR sites that you rotate at. Please ask your attending or CRNA if you need any help finding the locations of the N95 masks. We are here for you to serve as your advocates and support your learning. Please do not hesitate to reach out with any questions that you have, and we'll help make this the best learning experience possible for you. Additional safety and just OR culture etiquette things, thinking about the timing of when you ask questions in the operating room, depending on the acuity of the situation. If you have any questions regarding this, we're happy to give you tips and tricks to think about if this is your first time in the operating room. And your attendings, again, have all been there. We've all been third years, so we will help guide you through it. You'll go through and have an orientation to scrubbing and the general ways to enter into the operating room. Of course, avoid the blue drapes and touching any of the sterile equipment. And then please try to enter through your main core doors rather than the outside operating room doors during cases for sterility reasons. Your performance on this course is going to be in 3 different areas. So your clinical performance, showing up engaged and enthusiastic for learning and asking questions. And then an end of the rotation examination. The topic sheets, the daily topic sheets that we provide, are targeted towards the topics that are also on your end of rotation examination. Professionalism, including completion of your administrative documentations and charting of numbers of procedures, for example. So that concludes our anesthesia orientation overview. A reminder that you will have a question and answer session on your first day of the rotation. However, if you have any questions between now and then, feel free to reach out to Jacqueline Campbell or any of the clerkship leadership, and we'll be happy to assist you. Thank you so much for your time. We really look forward to seeing you soon on your anesthesia rotation.